Hello everyone. Today we are going to talk about the facial muscles and some of the common facial expressions which are produced by the facial muscles, and then we are going to talk about the some clinical correlation of the facial nerve, and in detail we are going to discuss about the facial nerve innervation of the face also. So first thing, for you must have to remember that whenever you are studying the facial muscles, please remember the facial muscles are inserted into the skin and they are present in the superficial fascia. So first point which you must have to remember, on the face there is a presence of superficial fascia, and in the superficial fascia it contains the facial muscles which are inserted into the skin. Second point which you must have to remember, that the vessels and nerves to the facial muscles, vessels and nerves to the muscles and skin are also present in the superficial fascia. Okay, there is some variable amount of fat is present there, but fat is absent from the eyelids. So fat is absent from the eyelids, and one important point, that fat is well developed in your cheeks. Deep fascia is absent on the face, but important point, that it is present except two places where the deep fascia is present, that is the parotid gland. So on the parotid gland, it is covered by the parotid fascia, that is the deep fascia of the face, and it is also present over the buccinator muscle by a fascia known as buccopharyngeal fascia. Okay, so deep fascia is absent in the face, but except it is present over the parotid gland and over the buccinator muscle. Okay, now these are some of the facial muscles which we studied in our last video. So some of the actions you must have to remember. Why? Because if there is any clinical pathology relating to the facial muscles, you have to know how to check these facial muscles. First thing what you must have to remember, that all the facial muscles motor innervation is by the facial nerve, one point, and sensory innervation, it is by the trigeminal nerve. So for example, if patient comes to you with Bell's palsy, you must have to know how to check the facial muscle. The patient comes to you with trigeminal neuralgia, you must have to know some of the actions of the facial muscles. For example, the occipitofrontalis muscle, or the frontalis muscle part of the occipitofrontalis muscle, it gives you an action of surprise. For example, the action of anger, it is given by dilator naris muscle. Here the dilator naris muscle, and depressor septi, and here will be present depressor septi. So it is given the action of the anger. Smiling and laughing, it is given by your zygomatic major muscle, this one. So the zygomatic major muscle, smiling and laughing, okay, it is by your which muscle? It is by your zygomatic major muscle. Sadness, it is by your levator labii superior, this one, that is this one which I am highlighting in the blue color, levator labii superior and levator anguli oris, this one. Okay, so these two muscles action, it will lead to what? It will lead to the sadness. So sadness expression is shown by levator labii superior and levator anguli oris. Okay, closing the mouth, it is by this muscle, this one, orbicularis oris. Closing the mouth, orbicularis oris muscle. Whistling, It is by the buccinator muscle and orbicularis oris muscle. It's not shown. Doubt. This is by this mentalis muscle. Okay, you have some doubt. And here there is one more superficial muscle present here, which is not shown here in the diagram. That is the platysma muscle. Okay, so this platysma muscle, whenever there is a expression of horror or you become frightened by something, so it is shown by this platysma muscle. Okay, so these actions are important because whenever you are going to check the patient with the facial nerve, for example, want to perform the facial nerve examination, you have to test the following muscles. So this is the diagram which I have taken from a book. So how you are going to check the facial nerve. So please remember, facial nerve, it is your seventh cranial nerve. And how you are going to test the facial nerve. For example, if you want to test the frontalis muscle, see here the diagram A. If you want to test the frontalis muscle, you are going to ask the patient to look upwards. Ask the patient to look upwards without moving his head. Okay, without moving his head. Okay, and you must have to look for what? You must have to look for these horizontal wrinkles. You have to look for these horizontal wrinkles. So first thing, how you are going to check the frontalis muscle, you are going to ask the patient to look upwards without moving his head and look for the normal horizontal wrinkles on the forehead. Okay, second, that how you are going to check the dilators of the mouth. So you will ask the patient to show the teeth. So when you ask the patient to show the teeth, okay, so showing the teeth, it means the dilators of the mouth are working properly. Third, test for orbicularis oculi muscle. You will ask the patient to tightly close the eyes. Okay, for example, in Bell's palsy, a patient cannot close the eye, so you must have to pad the eye. Otherwise, patient will develop keratitis. So patient cannot close the eye, so you have to check the orbicularis oculi also. So you will ask the patient to tightly close the eyes to check for the orbicularis oculi, which is innervated by the facial nerve. Fourth one, test for the buccinator muscle. So for the buccinator muscle, you will ask the patient for puffing the mouth and blowing forcibly as you are whistling. Okay, so this is how you are going to check the facial nerve in the patient. Okay, number one, ask the patient to look upwards without moving his head, to look for horizontal wrinkles. Then you have to look for the dilator of the mouth. You are going to ask for to show the teeth. Then you will ask the patient to tightly close the eyes, to look for the orbicularis oculi. For the buccinator muscle, you will ask the patient to puff the mouth with air and then blow it as you are whistling. Okay, so this is how you are going to check the facial nerve. For example, now see this diagram of students. Patient, for example, this is the case of Bell's palsy. So Bell's palsy, it can be infranuclear lesion or it can be supranuclear lesion. So if the patient is having infranuclear lesion of the facial nerve, it is mostly at the stylomastoid foramen. I will show you the diagram. Okay, and the foramen, this nerve can be damaged, and if it is damaged at the after the stylomastoid foramen, patient will develop Bell's palsy, and there will be what? There will be both upper and lower quarters of the face get paralyzed. Both will become paralyzed. Face become asymmetrical. Now see this diagram. This is a normal This is a normal side, this is a normal side. So for example, the facial nerve, it is exiting at the stylomastoid foramen. And when it is exiting the stylomastoid foramen, then it is innervating your face or facial muscle. Okay, so when it is exiting at the stylomastoid foramen, if there's any lesion or damage or compression of the facial nerve after the stylomastoid foramen, what will happen? First of all, these normal wrinkles will be gone. Patient cannot close the eyes. Okay, the affected side is becoming emotionless, wrinkles disappear. Patient cannot close the eyes. So patient cannot close the eyes, you must have to close the pad the eye, because it can lead to keratitis in the patient. Patient when try to smile, it will draws the mouth to the normal side, and there will be you can say tear flow, and there will be saliva flow also. Okay, so there will be tear flow and saliva flow also from the angle of the mouth on the same side. So this is on the same side. Okay, so this is known as Bell's palsy or Bell's paralysis. If the lesion is in the supranuclear lesion, okay, so supranuclear lesion before the facial nerve nuclei. So what will happen in the supranuclear? There will be part of hemiplegia. So there will be part of hemiplegia, but please remember, it will be to the opposite side of the face. So the opposite side of the face, okay, opposite side of the face is paralyzed. Lower opposite side of the face, it will be paralyzed. So see here, if it is infranuclear lesion, it is on the same side. So if Bell's palsy, if you see a patient of Bell's palsy, if it is on the right side, it means the lesion is on the right side. But if the patient comes to you and he is having the paralysis of only the lower quarter of the facial muscles, it means that the lesion is on the opposite side. So for example, if in this picture it is on the right side paralysis of the lower quarter of the facial muscles, it means the lesion is on the right side. So please remember, in supranuclear lesions of the facial nerve, it is usually a part of hemiplegia, which means paralysis, with injury of corticonuclear fibers. Okay, and only the lower quarter of the opposite side, the lower quarter of the opposite side of the face will become paralyzed. Upper quarter, for example, the frontalis muscle, orbicularis oculi muscle, they will escape. Okay, because it is getting the bilateral representation from the other side, so it is not going to damage. So here the patient can open the eye, patient can close the eye, wrinkles will be going to form normal. Okay, so please remember, this is your supranuclear lesion and infranuclear lesion. Okay, now coming to this picture, I said to you that the sensory innervation of the face, it is done by the trigeminal nerve. Trigeminal nerve, it is your fifth cranial nerve, and it is having three branches. Ophthalmic branch, okay, number one, it is the ophthalmic branch. Second, maxillary branch. Third one, mandibular branch. Okay, now see this diagram. This is the ophthalmic branch, this is the maxillary branch V2, and this is the mandibular branch. So these three branches are innervating your your what? They are innervating your trigeminal nerve. It is giving the sensory supply to the face. But what is important here, that this portion is not supplied by the trigeminal nerve. So please remember, skin over the angle of mouth. This is your potential MCQ. Skin over the angle of mouth or angle of jaw, sorry, and over the parotid gland. So here there will be presence of the parotid gland, and over the parotid gland It is supplied by your great auricular nerve. This is your potential MCQ, please remember it. Okay, so this whole area which I am highlighting in red color, this whole area, it is innervated not by the trigeminal nerve, it is innervated by your what? Great auricular nerve. So patient can comes to you with trigeminal neuralgia. Okay, so what is trigeminal neuralgia? Please remember, it is a recurrent, brief episodes of severe unilateral pain in the cranial nerve 5 distribution. Okay, cranial nerve 5 distribution. This one 1, this one 2, this one 3. So here patient will have severe pain. Sometimes the patient will describe you that the pain is like electric shock. Okay, and it can last for seconds, and it can be triggered by some light facial touch, or when you patient is going to talk, or when patient is going to chew the food, so patient can develop the pain. So what is the treatment of the trigeminal neuralgia? Treatment of the trigeminal neuralgia, answer is carbamazepine. Okay, so this is also your MCQ. So these 2 points which you must have to remember. Now see this diagram, all students. I explained to you that the facial nerve, it is the motor nerve of the facial muscles. Okay, so all these facial muscles, so facial nerve motor component, please remember, as it is passing out, for example here there will be the stylomastoid foramen, and as it is exiting the stylomastoid foramen, it is giving here 5 terminal branches like this, like the hand. 1, 2, 3, 4, 5. Temporal branch 1, zygomatic branch 2, buccal branch 3, mandibular branch 4, and the cervical branch 5. See here, temporal branch, it is innervating the frontalis orbicularis oculi corrugator supercilium muscle. Zygomatic branch, it is innervating the lower part of the orbicularis oculi muscle. Buccal branch, zygomatic major, minor, buccinator muscles, and muscles around the oral cavity also. Mandibular branch, it is also mentalis muscle, depressor angulioris, depressor labii inferior rizoris muscle. And cervical branch, it is innervating the platysma muscle. So facial nerve is having 5 motor branches. Okay, so these 5 branches which you must have to remember, which is innervating the whole your facial muscles. So now we must have to discuss the facial nerve. So please remember, this is the diagram. See here once again. This is the facial nerve, and now it is giving here the tympanic branch, zygomatic branch, the buccal branch, the mandibular branch, and the cervical branch. Okay, and then there are some some other small short branches to the digastric muscle also, and the stylohyoid muscle also. Okay, so these are the main branches, motor branches of the facial nerve. But we must have to study the facial nerve in detail, because it is in relation to some ganglions also, which are very, very important. So we must have to know what are these facial nerves and what are their functions. So first thing what you must have to remember, facial nerve is a mixed nerve. Mixed nerve means what? It is having a motor component also, and it is having a sensory component also. Okay, so it is having a motor root also and sensory root also. The sensory root is also sometimes known as nervus intermedius. Okay, it is known as nervus intermedius. Please remember facial nerve nuclei. It is present in the pons. It is present in the pons. So whenever you are studying the nerves, please remember you can draw the diagram like this. See here. Midbrain, pons, medulla oblongata. So this is your brain stem. So see here. From midbrain, your third and fourth cranial nerve nuclei are present. Pons, fifth, sixth, seventh, and eighth cranial nerve nuclei are present in the pons. Medulla oblongata, 9, 10, 11, and 12 cranial nerve nuclei are present in the medulla oblongata. Okay, so it is present, it is mixed nerve, the nuclei is present in the pons, and the facial nerve fibers are exiting from the pons at pontomedullary junction. Pontomedullary junction. I will show you the diagram. It is exiting at the pontomedullary junction. And please remember, first of all, I will show you the diagram. See here, this is the facial nerve nuclei. But see this diagram. Now this is the cross section now. Now see here all students. This portion, this is your midbrain. This portion, this is known as pons. And this one, this is known as medulla oblongata. Okay, so from the pons you already know that your which cranial nerves are 5, 6, 7, 8. Midbrain 3, 4. Medulla oblongata 9, 10, 11, 12. Okay, now see the diagram. Facial nerve nuclei. This is your facial nerve nuclei which I am highlighting in dark green color. This one. It is present in the pons, and now it is making a turn around your sixth cranial nerve and then exiting. This is your pontomedullary junction. Now exiting the facial nerve fibers outside like this. Okay, so this turn of the facial nerve around this one, which I am highlighting in blue color, this is your sixth cranial nerve, abducer nerve. Okay, which is innervating your lateral rectus muscle of the eye. Okay, so see here, facial nerve nuclei, facial nerve fibers are bending around the sixth cranial nerve and then exiting out from the pontomedullary junction. This is known as internal genu of the facial nerve, and it will make a compression. See this diagram now. This is a cross section of the pons. See here, this one is your abducer nerve, which I am showing at the moment in blue color. This one, which I am showing in the red color. This one. This is your facial nerve nuclei. Now see here, fibers are bending around the abducer nerve, and this is known as internal genu of the facial nerve. Okay, so this is known as internal genu of the facial nerve. Clear to everyone? So this internal genu of the facial nerve, what you must have to remember, it is around your sixth cranial nerve. This is abducer nerve, sixth cranial nerve. It is your sixth cranial nerve. So this is one fiber. This one. Other fibers of facial nerve, It is also coming from this superior salivatory nuclei and nucleus of tractus solitarius. Nucleus of solitary tract fibers are coming, and some fibers from another nuclei, that the superior salivatory nuclei. Some fibers are also coming, and now all these three fibers together, they are forming your facial nerve. Okay, so facial nerve fibers are not only coming from the facial nuclei, some fibers are coming from the superior salivatory nuclei also. Some fibers are also coming from the nucleus of tractus solitarius also. I will tell you in detail later when we will draw the diagram, then it will become more easy for all of you. Okay, so see here all students now. So facial nerve, it is a mixed nerve, clear, and now it is exiting out, see this diagram, from the pontomedullary junction. And when it is exiting out from the pontomedullary junction, now please remember, it is going to enter into the, okay, I will write it here, it is going to enter into the internal acoustic meatus. Okay, so now the fibers, see here this diagram, the fibers exiting out from the pontomedullary junction, and when they are exiting out from the pontomedullary junction, it is entering into the internal acoustic meatus along with another nerve. Which nerve? That is your eighth cranial nerve, vestibulocochlear nerve. Okay, vestibulocochlear nerve. So internal acoustic meatus is having nerve fibers of 7th cranial nerve and 8th cranial nerve. Okay, so see here. So the fibers of the facial nerve along with the fibers of the vestibulocochlear nerve, they are entering into the internal acoustic meatus, where in the petrous part of the temporal bone, in the cranial fossa. You must have to see my lecture of cranial fossa foramen, then you can easily understand it. Okay, and now please remember, when it enters into the internal acoustic meatus, now our facial nerve, it will enters into the facial canal. I will show you in the diagram, no need to worry. And when it enters into the facial canal, now it is running laterally into the internal ear. Okay, and when it reaches the medial wall of the middle ear, when it reaching the medial wall of the middle ear, it is going, the nerve is going to swells, and it is going to form here a sensory ganglion known as geniculate ganglion. Okay, geniculate ganglion. Now see this diagram, all students. See here. This is an internal acoustic meatus which is present in the petrous part of your what? It is present in your petrous part of the temporal bone. Okay, and now it is entering from the internal acoustic meatus along with your which nerve? 8th cranial nerve. Okay, along with your which nerve? 8th cranial nerve. After that, now it will enter into the facial canal. Now it is entering into the facial canal. Okay, and as it entering into the facial canal, now it will reaches the middle ear cavity. And when it reaches the middle ear cavity, it is going to have a swelling like this. This is known as geniculate ganglion. This is a sensory geniculate ganglion which will receive the fibers of the taste from the tongue and from the palate also. Okay, so this is your sensory geniculate ganglion. Now please remember very important point. Now it will go. See here. Now after the geniculate ganglion, now it is going downwards and now it is going to give here the branches. One branch, second branch, and third branch. Three branches. This one, it is your greater petrosal nerve, second nerve to the stapedius, and third one, that is the chorda tympani. And after that, now it is exiting out. Okay, so the nerve descends behind the pyramids and it emerges from the temporal bone through the stylomastoid foramen. And after that, see here, it is giving some posterior auricular nerve branches, and here there will be presence of parotid gland also. Parotid gland, but it is not innervating the parotid gland. Please remember it forever. And now it is giving here these 5 terminal branches: temporal branch, zygomatic branch, buccal branch, mandibular branch, cervical branch. Okay, see this diagram, all students. See here this diagram. Okay, see here, this is your internal aqueous meatus, which I am highlighting in green color. So now your facial nerve is entering. Wait one second. See here, this is your internal aqueous meatus. Now the nerve enters into this canal. This canal is known as facial canal. This one. Here, this is a swelling. It is a swelling of the facial nerve that is known as geniculate ganglion. Please remember, it is a sensory geniculate ganglion which is receiving the taste fibers. And now it is giving here this branch, nerve to the stapedius. It is giving here this branch. This is this is your which nerve? Greater petrosal nerve. Sorry, this is your greater petrosal nerve. This is your stapedius nerve, and this is one more branch here. That is the chorda tympani. See here, geniculate ganglion, then 3 branches: greater petrosal nerve, one nerve to the stapedius, and chorda tympani nerve. Then it is exiting the temporal bone by this foramen. This foramen. This foramen is known as stylomastoid foramen. And then it is exiting out, giving 5 terminal branches. 1, 2, 3, 4, 5. Okay. So this is how you must have to understand the facial. Now see this diagram, all students. Okay. First of all, we will see this diagram. Then we will draw the diagram ourselves. Then it will be very easy for you to understand. This is very, very important topic. So you must have to understand it. So see here. I explained to you what? Facial nerve fibers are coming out from the tip of the nucleus tractus solitarius also, and from your superior salivary nuclei also. And then there is a one more nucleus, that is the facial nerve nuclei. All these fibers together are forming the facial nerve. It is exiting. See here, it is making here together the facial nerve. Now see here, all students. It is entering. One second. So it is entering here into the, it is exiting the internal aqueous meatus. And after the internal aqueous meatus, see here, it is going to make here a geniculate ganglion. And after making a geniculate ganglion, this is present in the facial canal. And in the facial canal, it is going to give here the branches. Okay, give here the branches. This branch is known as greater petrosal nerve. This branch is known as chorda tympani nerve. One branch which is not shown here, that is the nerve to the stapedius muscle. And as it is exiting the stylomastoid foramen, it passes through the parotid gland. It is not innervating the parotid gland. Please remember, facial nerve is not innervating the parotid gland. Parotid gland, it is innervated by your glossopharyngeal nerve. This is your potential MCQ. Glossopharyngeal nerve, that is your ninth cranial nerve. Okay. So through greater petrosal nerve, it is innervating your lacrimal gland. It is innervating your lacrimal gland, it is innervating your nasal gland, it is also innervating your palate, it is also innervating through chorda tympani your sublingual gland and your submandibular gland. Okay, so at the moment maybe you are not understanding me, but we will draw the diagram and then it will be easy for you to understand. Okay, so all the students, you must have to draw this diagram along with me. So first thing, see here all students. Number one, see here. This is your brain stem now. Now in the brain stem, see here. This is your This is your midbrain. This is your pons. This is your medulla oblongata. Okay. Now see here all students. This is the facial nerve nuclei, motor nuclei. It is making a band here like this. This band of the facial nerve, it is known as internal genu of the facial nerve. Okay, it is known as what? Internal genu of the facial nerve. Clear to everyone? Now here one more nuclei is present. Here. This is known as superior salivatory nuclei. You have to draw this diagram with me. And this is your inferior salivatory nuclei. Please remember, inferior salivatory nuclei through the glossopharyngeal nerve, which is your ninth cranial nerve, it is innervating your parotid gland. Parotid gland is not innervated by the facial nerve. Through superior salivatory nuclei, it is giving the secretomotor fibers, that are your GVE. Okay, these fibers, it is going to give to the lacrimal gland, to the palate glands, nasal glands, submandibular glands, and your sublingual gland. Okay, so all the glands through, and this superior salivatory nuclei, which I am highlighting in blue color. Now the nerve fibers from here are also joining the facial nerve here. Okay, and there is one more nuclei here, that is your nucleus tractus solitarius. Okay, so the tip of the nucleus tractus solitarius, here the fibers are also joining the facial nerve. So all these three fibers together, they are known as the facial nerve. Okay, so this one is the motor fibers of the facial nerve, and nerve fibers from the superior salivatory nuclei and the tip of the nucleus tractus solitarius, they are the sensory nerve fibers. So they are known as what? Nervus intermedius. So sensory node nervus intermedius, it is formed by the fibers of superior salivatory nuclei and the tip of tractus solitarius, like this. Now they are making the facial nerve nuclei. Facial nerve. Now the facial nerve is exiting at which junction? Ponto. This is medulla oblongata. This is pons. So this is your pontomedullary junction. Okay. Now as it exiting there. Now see here all students. Now it is going to enter into the internal aquatic meatus. It is entering where? Into the internal aquatic meatus. So as it enters into the internal aquatic meatus, what is going to happen now? Okay. So as it enters into the internal aquatic meatus, in the internal aquatic meatus, please remember, along with seventh cranial nerve, which nerve is present? Eighth cranial nerve is also present there. Okay. So now it is entering here into the internal aquatic meatus, making a band here. This band is known as external genu of the facial nerve. See here, this band here, this band here, this is known as the internal genu of the facial nerve. This band here, it is known as what? External genu of the facial nerve. Now as it exiting here at the external, this is the external genu of the facial nerve. Now see here, as it is entering into the facial canal. Now the nerve is present where? Our facial nerve, it is present in the facial canal. And now in the facial canal, the nerve will swells to form the geniculate ganglion. This is your geniculate ganglion. Sensory ganglion, which is going to take the fibers from the anterior 2/3 of the tongue and it will send it to the tip of the nucleus tractus solitarius here. Tip of the nucleus tractus solitarius. So this is the geniculate ganglion. Okay. After the geniculate ganglion, see here. Now the nerve fibers are going like this. And now it is going to give here one branch. One branch. Second branch. Third branch. And now it is exiting the stylomastoid foramen. So this is your what? Stylomastoid foramen. And as it is exiting the stylomastoid foramen, here there will be presence of what? This is your parotid gland. So this is your which gland? Parotid gland. So it is not innervating the parotid gland. Please remember it forever. Parotid gland is not innervated by the facial nerve. Okay. So please remember, the facial nerve passes forward through the parotid gland and then it is going to give here 5 branches. Passes through the parotid gland and give here 5 branches. Temporal branch, zygomatic branch, buccal branch, mandibular branch, and cervical branch. Okay. Now see here, if patient is having lesion here after the stylomastoid foramen, all these muscles are becoming non-functional and patient will develop what? Bell's palsy. Patient cannot close the eye, there will be no wrinkles. They're on the same side, not on the opposite side. It is an infranuclear lesion. Okay, on the same side. Now these 3 branches of the facial nerve. This branch here, this is known as greater petrosal nerve. This is your which nerve? Greater petrosal nerve. So see here, greater petrosal nerves arises from the nerve to the geniculate ganglion. So these are your parasympathetic fibers. And now it will go and make here a ganglion. This ganglion is known as what? This ganglion is known as pterygopalatine ganglion. Pterygopalatine ganglion. And now the nerve fibers from here, they are going to innervate the lacrimal gland, the nasal gland, and the palate glands also. Okay, so this is your pterygopalatine ganglion. Okay, so the greater petrosal nerve, it is forming your pterygopalatine ganglion. So these preganglionic fibers are the greater petrosal nerve. These postganglionic fibers, it is from your trigeminal nerve. Okay, trigeminal nerve. Please remember it. It is from your trigeminal nerve. Now one thing you can add here that is very important. Here there is a formation of a canal. This canal is known as pterygopalatine canal. And here one nerve is entering here and joining with the greater petrosal nerve. Now forming here this nerve. This is the nerve of the pterygopalatine canal. This nerve, this one, this is known as what? This is your deep petrosal nerve. Deep petrosal nerve. Now you are going to ask me, sir, where this deep petrosal nerve come? Please remember here you have your internal carotid artery. And along the internal carotid artery, it is surrounded by your T1 sympathetic fibers. From these T1 sympathetic fibers, these are your what? T1 sympathetic fibers present and around your internal carotid artery, which are coming out from your superior cervical ganglion. Okay, and now it is forming here this nerve. This is known as deep petrosal nerve. Deep petrosal nerve join with the great petrosal nerve, entering into this canal known as the nerve of the pterygopalatine canal. And now it is forming here this ganglion, pterygopalatine ganglion. Now it is innervating these three: lacrimal, nasal, and the palate gland. So see here, these three are by your pterygopalatine ganglion. The two remaining, submandibular and sublingual, these two, it is by your submandibular ganglion. It is by your what? Submandibular ganglion. Now see here. Second branch is the nerve to the stapedius. Nerve to the stapedius. Third branch of the facial nerve, this is known as chorda tympani. Now this is very important. Now chorda tympani is going, and now it is making here this ganglion. This is your submandibular ganglion. Okay, so chorda tympani, please remember, it arises from the facial nerve in the facial canal. Okay, and it contains preganglionic. Okay, so this is your what? This is the ganglia, so it will be your what? Preganglionic nerve fibers. Which nerve fibers? Parasympathetic preganglionic nerve fiber. This is also your preganglionic parasympathetic nerve fibers. Okay, so chorda tympani contains what? Preganglionic parasympathetic secretomotor nerve fiber to the submandibular ganglion, and here it is going to form. Again, the trigeminal nerve is going to help here by the lingual nerve, which is a branch of the mandibular nerve. And now it is going to innervate your two glands. Which two glands? Submandibular gland secretion and sublingual gland. Clear? So this is how it is innervating your nerve fibers. So once again, see all students. It's not difficult. It's very easy. Now one more thing. All these fibers, see here, they are the branches of the facial nerve. And here if I draw here the tongue, for example, this is our tongue now. So tongue, please remember, anterior 2/3 of the tongue taste fibers. It is also by the facial nerve. And now it is also taken by the chorda tympani. And from the chorda tympani, it is going into this geniculate ganglion. Because geniculate ganglion is our sensory taste. For taste and sensory sensation, it is received by the geniculate ganglion. And from here, the fibers are going here into the facial canal, internal aguated meatus, and now it will reaches at the tip of the nucleus tractus solitarius. So the tip of the nucleus tractus solitarius, it is taking the sensations of the taste, receiving from the anterior 2/3 of the tongue. Okay. So this diagram is very, very important. So if you draw this diagram yourself one time, then it will be very easy for you to understand. Okay. Now see the diagram, this diagram. Once again, I am showing to all of you. Now see here all students. Facial nerve forming here the geniculate ganglion. Now it is giving here the branches. This first branch which is showing here, that is the greater petrosal nerve. It is joining here by this branch. That is the deep petrosal nerve which is coming out, which are fibers of the internal carotid plexus around the internal carotid artery joining together forming a nerve in the pterygopalatine canal. This is your pterygopalatine ganglia. And from here, the fibers are going and giving innervation to the lacrimal gland, to the nasal gland, and to the palate gland also. Okay. Second, as it is going downwards, this is the stylomastoid foramen. It exiting and passing through the parotid gland, not innervating the parotid gland, giving here 5 terminal branches. Parotid gland innervated by your glossopharyngeal nerve. So this one branch is your chorda tympani. So this is your chorda tympani. Chorda tympani. And now it is going downward, making here a ganglion. This ganglion is known as submandibular ganglion. And now from the submandibular ganglion, it is giving nerve fiber to the sublingual gland. It is giving nerve fiber to the submandibular gland. So these glands, 1, 2, 3, 4, 5, all the sensations of these glands, it is controlled by your superior salivatory nuclei. But the anterior 2/3 of the tongue and some of the taste bud sensations of the soft palate, it is controlled by your nucleus tractus solitarius. Okay, taste sensation from 2/3 of the anterior tongue, it is going into the tip of the nucleus tractus solitarius. Through which nerve? आपका आंसर होगा सर, it is through chorda tympani. This is your chorda tympani nerve. Chorda tympani nerve. अगर मैं आपसे पूछूंगा सर lacrimal gland, it is innervated by which nerve? Which nucleus it is controlling? Answer will be superior salivatory nuclei. So superior salivatory nuclei, it is controlling lacrimal gland, palate gland, nasal, submandibular gland and sublingual gland also. Only one gland which is not controlled by the facial nerve, that is the glossopharyngeal nerve. It is controlled by your inferior salivatory nuclei, and all others are by superior salivatory nuclei. Lacrimal, nasal, submandibular, sublingual, all are controlled by your facial nerve. Okay, so this is your lecture of the facial nerve, submandibular ganglion, sublingual ganglion. See here this diagram. This is the geniculate ganglion. Now it is giving here this branch. This is the greater petrosal nerve. It is joined here by the deep petrosal nerve, which is sympathetic T1 sympathetic plexus around the internal carotid artery, forming the nerve of the pterygoid canal. And then here it is going to find a pterygopalatine ganglion. So this will be your pterygopalatine ganglion, and then it is going to innervate your lacrimal gland, your nasal, and your palate gland. Okay. This is the nerve to the stapedius muscle. This is your chorda tympani. This one. Chorda tympani. So this chorda tympani, it is going to join with the lingual nerve. So here it is going to form submandibular ganglion, and then it is going to give innervation to the submandibular gland and your sublingual gland also. Okay, so this is how you are going to study the facial nerve and the course of the facial nerve. Very, very important topic. So you must have to know. So if you draw this diagram yourself, this one, then you will never ever going to make mistake. Thank you.